Hi, Karen. First of all, I'd like you to tell us a bit more about W Foundation and the work that you are doing.
It was a pleasure, Mike. We are a Swiss independent foundation from WHO, but affiliated with them. And our mission is to support the mission of the WHO by providing additional funding for them, but also enabling partnerships with the private sector. That is hugely important because the WHO is such an essential element of global health and really at the core of it, but it is underfunded. It is not funded to accomplish that mission. Only 1/3 of the present budget is funded at this stage, and even a small part of that is flexible funding. So we focus on fundraising from philanthropists, corporates, the private sector, but also individuals, all the areas where the WHO is not set up to fundraise from. We also enable partnerships with the private sector, basically creating the bridge between the private sector, governments, and NGOs, because them working all together in the ecosystem is the best precondition for providing excellent health for everybody in the world.
Could you give us some example of recent fund mobilization that you've been doing?
The most recent one is very much related to the Ukraine crisis. So shortly after the invasion, basically by Russia, the WHO already launched an appeal over 57 million to support the Ukrainian government in maintaining the healthcare system. That is an important role of the WHO, complementary to what other organizations do. And so we are supporting with our Ukraine health appeal this endeavor. So the WHO, with the support of these funds, has very importantly established the supply lines with the different cities, main cities in the Ukraine. And they have delivered nearly 400 metric tons of supplies and equipment to the hospitals, to pharmacies, in order to keep the supply intact. That has enabled 16,000 surgeries. We've basically been able to supply healthcare provisions for 650,000 people. This is very much focused on the Ukraine itself, in contrast to a lot of the organizations who really work with the refugees. And even now, if you think about it, the biggest part of the population is still in the Ukraine. So there are 12 million people at the moment in the Ukraine who have regular need for access for chronic diseases, cancer, pregnancies, children still get born, and keeping that intact is a main mission. So now the WHO has just launched a second appeal in order to be able to provide this continued assistance for the next 3 months as well.
I'd like now to talk about the technology angle and understand how technology is helping WHO Foundation. Looking back at your journey with Salesforce and Nexell, what were the main challenges you wanted to solve when you reached out to us for support?
We are such a young organization, so for us what was really important in building this organization that we have a knowledge management system. We are working with an organization with consultants also who are really spread across the world, so we're not all sitting in Geneva, and making sure we have a system that captures that increasing knowledge base that we are basically building up from scratch was really, really important. That goes with the first focus on fundraising and networking, basically a CRM system in that sense, being able to build that pipeline, making sure that when we onboard new people, they are quickly basically adapted to what we already have. It's a great way for them to learn about what we have already been doing. So that is really one important element. The second one is also about the fund allocation. Because this not just ends with the donor journey, but it's also obviously we are receiving funds, but then we also need to make sure, because we are fundraising for different programs, on where these funds are then being allocated. So this is another challenge that we are facing and that we really wanted to capture with Salesforce.
And why have you selected Nexell and Salesforce for that project?
Let's start with Salesforce first, maybe. Salesforce has one very unique product that is tailored for nonprofits. So it captures what we need in terms of tracking the fundraising pipeline, but then also being able to use this for marketing purposes, for active outreach to donors. The question about allocation of these funds to different programs, those are all elements that are really important for us, and Salesforce basically against those criteria performed really well. The other element are also the abilities to integrate various other platforms. So we're working, for example, with G Drive, being able to integrate also notes or meetings, emails into these systems is an important way. So we have one repository for everything, and we don't have to use different platforms at the same time. With regards to Nexell, it's very strong customer orientation. They really understood what we're looking for, and they spent a lot of time building that relationship, understanding our processes, and therefore also really not just implementing, but also advising us on how we can basically develop the system, how we can tailor it best to our needs. Obviously, the vicinity being 5 minutes from each other also helps, but also a really strong commitment to us as an organization, and we saw in them really a long-term partner. And that has certainly come to fruition based on our experience with them.
So what are the benefits of this technology for WHO Foundation staff?
As I mentioned before, one important part is the central repository. So it's a very easy access to information that is critical, especially for the fundraising team. And given that we are across different locations geographically, including the US, including Asia, that is important to have easy access. We are also onboarding a lot of new people, so getting them up to speed with the help of that information resource is very, very important and has really facilitated the onboarding, especially in the fundraising team. But beyond that, it also helps us to integrate across different functions. So for example, the link between the fundraising team and the operations team is also captured in that system. The whole question about having to do due diligence on our donors is basically managed through the system. So the interaction between the fundraising team and the legal team, the due diligence team, is seamless, basically. Same with the finance team. If funds are received, it basically is fed back into the system, so the fundraising team is informed right away. So it also captures not just one department, but really the collaboration across the whole organization.
So what are the next steps for the foundation?
Until now, the work has been mostly focused on COVID-19 and, of course, as we talked about, the Ukraine appeal. But we are now developing our investment strategy or fundraising strategy for the coming years from 23 to 25. And these are really targeted at the general program of work of the WHO. So we've been collaborating with them, developing that. There's 3 areas we're going to start with this year that we are launching. That is digital health, mental health, and health emergencies. So those are 3 areas we are going to start fundraising for, and those will be followed by 3 other areas that we are going to launch more towards the end of the year, which is climate and health, health equity, and primary healthcare services.
So how can we all support WHO Foundation?
If you want to support the WHO Foundation, first go to our website, who.foundation, to learn more about what we do. But you can also concretely directly contribute now to 3 campaigns that we are currently running. One we already talked about, the Ukraine appeal, to really support the critical healthcare system in the Ukraine, but also in neighboring countries. You can also support vaccine equity, the Go Give One campaign, and then the last one is basically the COVID-19 program of WHO to make sure that we bring an end to the pandemic, and not just in the European north, but also in the developing countries, so across the world, to be safe from that pandemic.
So thanks a lot for your time, Karen. We're really pleased to be part of this adventure with you, and we hope to help you also in the future. So really thank you for your time.
And Mike, it's been a pleasure, and I was very happy to be invited and be able to talk about the WHO Foundation. So thanks a lot for that.
You're welcome.
NexellAngels is a core part of our DNA. My name is John Sass, founder and managing partner of Nexell. I am extremely proud of our NexellAngels team, who have helped nonprofit, educational, and philanthropic organizations for the last 20 years implement Salesforce solutions, helping them be the best they can be.